Another YouTube viewer asks, I had a successful vestibulectomy, but some pain remains on the urinary meatus. I think it's urethral meatus she's referring to, which
Mhm.
can't be removed, of course, right? So the question from
But
that
it can be removed. We're doing research. We're doing a study in Washington, D.C., where we're taking out the last half an inch of the opening of the urethra. So we are actually now doing a study to remove this tissue um, safely, and we believe it's going to be successful.
Dr. Davidson, you could speak to this, seem to have had that experience where we've done our best vestibulectomy for patients with medically refractive. Dr. Davidson, have you run into this issue, and what do you typically do?
Dr. Goldstein has trained me to do a vestibulectomy. I'm so privileged, and it's very important to remove the Skene's gland ostia, which is super close to the urethra. And so I think it's an important point. Not many of us, not many other physicians do vestibulectomies, and so to make sure that whoever did it, is there any, or even to check our own work, is there any residual tissue where you really medial to the Skene's gland ostia? Is there any role of resecting that little bit of tissue that might be actually the source of the pain, which is probably worthwhile investigating even before the urethral resection, perhaps, if that's the case.
I want to spend 1 or 2 more minutes on vulvodynia. The question is, how much do you think anxiety and stress contributes to vulvodynia symptoms for a woman who already has vulvodynia?
About 40% of women who have diagnosed with vulvodynia meet the criteria for an anxiety disorder. Now, that is important to realize that that doesn't mean that their pain is because they are anxious. The thing about anxiety is it does two things to increase the pain. First of all, the neurochemicals in the brain that are responsible for anxiety are the exact same neurochemicals in the brain that are responsible for pain. The second thing that increases pain related to anxiety is that women who are anxious, tend to tighten up their muscles. They tend to hold in their stress or their anxiety in their muscles. And what that happens is when the muscles get tight, that causes decrease in blood flow to the area, including the pelvic floor, which causes a buildup of lactic acid in the muscles, as well as causes increase in inflammation, and therefore will cause an increase in pain. But I also want to emphasize, and I really want to emphasize, that that doesn't mean that your pain is in your head and that you're crazy and that the only reason you have pain is because you're anxious.
I'm going to get to one more question. Can tight pelvic floor muscles cause delayed pain after sex, such as 24 hours later?
When a muscle is tight, there's decrease in oxygen going. There's decrease in blood flow going to the muscle. In addition, lack of oxygen causes a buildup of inflammation. And so in that situation, tight pelvic floor muscles can cause burning all the time, or if those muscles get pressed on, like during intercourse or during orgasm, the muscles contract. So that can release the lactic acid and therefore cause a delayed pain response, but there is pain.
Let's have Dr. Goldstein talk now about some other vulvar disorders.
So about 1 in 60 to 1 in 70 women are skin diseases of the vulva. The vulva is skin, but there are specific skin diseases that can affect the vulva that typically just go there because of the unique environment of the vulva. The most common of those diseases is something called lichen sclerosus. Lichen means thick and scaly in Greek, and the word sclerosis means scarring in Greek. And this is a skin disorder that it can affect females of all age. And what lichen sclerosus can do is it can cause itching, it can cause scarring of the vulva, it can cause pain with intercourse, it can cause the entire distortion of the anatomy and scarring of the anatomy of the vulva. And unfortunately, in about 5% of women who get lichen sclerosus, they can develop cancer if not appropriately treated.
So, Dr. Davison, just kind of moving towards wrapping up and talking to our viewers out there about general vulvar health and just taking care of yourself on a daily basis.
I think one of the take homes from this session just simply is to be familiar with your anatomy and not be afraid to check with the mirror, just to know your baselines, that if you have a symptom or if you notice something different, you'll be able to realize and bring it to the attention of your physician. And, avoiding sort of irritating products, some things that are even marketed towards women that can be deceptive, such as pH balance and wipes and feminine health, which actually really can throw off things and throw off pH. Wearing cotton underwear or no underwear. So a lot of the things that we talked about last week are applicable, because even though these might be different conditions such as lichen sclerosis or vestibular vulvodynia, they can be irritated by the same contacts, the same irritants.
We've had some amazingly insightful questions from our YouTube audience. We really appreciate you guys participating. Absolutely fantastic. Thank you, Dr. Goldstein, very much for your time. Thank you, Dr. Davison, very much for your time in joining us today. Once again, vulvodynia.com for Dr. Goldstein, maidenlanemedical.com for Dr. Davison. Thanks for joining us on our YouTube channel. Please, please, please subscribe to our YouTube channel. We're going to keep these presentations going every week until the cows come home, and even well past COVID-19 crisis and pandemic. We really love doing this. We've discovered a new wheelhouse for ourselves, and we're fantastically excited to continue to talk about it. Have a great day, everybody. Stay safe. Keep your families safe, and be well.